Psoriasis, unveiling the skin's persistent challenge. Psoriasis is a chronic skin disorder characterized by the rapid multiplication of skin cells, resulting in the formation of bumpy patches. The patches can vary in color and texture, with redness and white scales on lighter skin and purplish or brown patches with gray scales on darker skin. While psoriasis can occur anywhere on the body, it commonly appears on the scalp, elbows, knees, and lower back. Importantly, psoriasis is not contagious and tends to have a genetic component, often running in families. Psoriasis symptoms. The symptoms of psoriasis depend on the specific type and may include plaques. Plaques are a hallmark feature of psoriasis, and their appearance can vary based on skin tone. On lighter skin, these plaques manifest as red patches, often adorned with silver-colored scales. Conversely, on darker skin tones, they may present as dark brown or purplish patches with gray scales. The discomfort associated with plaques extends beyond their appearance, as they can be both itchy and painful. In more severe cases, these plaques have the potential to merge, covering expansive areas of the skin and further exacerbating the condition. Nail issues. Psoriasis frequently affects the nails, leading to various changes in their appearance and structure. Individuals with psoriasis may notice alterations in nail color, which can range from subtle discoloration to more pronounced changes. Small pits may develop on the surface of the nails, contributing to a rough or uneven texture. Additionally, nails affected by psoriasis may become prone to crumbling or, in some cases, detachment from the nail bed. These nail manifestations can significantly impact the overall health and appearance of the nails. Scalp involvement. The scalp is a common site of psoriasis involvement, presenting with plaques, scales, or crust. These manifestations can lead to discomfort and aesthetic concerns. Scalp psoriasis may extend beyond the hairline, affecting the forehead, neck, and behind the ears. The presence of these symptoms on the scalp often requires targeted and consistent management to alleviate symptoms and improve the overall health of the skin on the head. Psoriatic arthritis. Psoriatic arthritis is a distinctive complication that can arise in individuals with psoriasis. This condition involves inflammation of the joints, leading to joint pain, swelling, and stiffness. Psoriatic arthritis affects a significant proportion of people with psoriasis, estimated to be between 10% to 30%. It can impact various joints, including those in the fingers, toes, knees, and spine. Prompt recognition and management of psoriatic arthritis are crucial to mitigate its effects on joint function and overall quality of life. Psoriasis types. Apart from plaque psoriasis, other types include pustular psoriasis, characterized by discolored, scaly skin with tiny pustules on palms and soles. Guttate psoriasis, often starting in childhood, it causes small, colored spots, triggered by infections, stress, or medications. Inverse psoriasis results in shiny lesions in skin folds, appearing bright red on light skin and darker on dark skin. Erythrodermic psoriasis leads to intense skin discoloration and shedding of scales, triggered by sunburn, infections, medications, or stopping certain treatments. Causes of psoriasis. Immunological factors. The precise cause of psoriasis remains elusive, but it is widely accepted that the immune system plays a central role. In individuals with psoriasis, the immune system is believed to be triggered by various factors, leading to an abnormal and exaggerated immune response. This heightened immune activity results in inflammation and an accelerated growth of skin cells. Genetic predisposition. Genetics is a significant factor in the development of psoriasis. More than 80 genes have been identified as being different in individuals with psoriasis compared to those without the condition. These genes are associated with various aspects of the immune system and skin cell regulation. The hereditary nature of psoriasis is evident in its tendency to run in families, though it can skip generations. This genetic predisposition contributes to an individual's susceptibility to developing psoriasis. Environmental triggers. While genetic factors lay the groundwork, environmental triggers can precipitate or exacerbate psoriasis in susceptible individuals. These triggers may include cuts and injuries. Trauma to the skin, such as cuts or surgical procedures, can act as triggers for psoriasis flare-ups. Emotional stress. Psychological stress is recognized as a potential trigger for psoriasis. Emotional challenges and high stress levels may contribute to the onset or worsening of symptoms. Infections. Certain infections, particularly streptococcal infections, can serve as triggers for the development or exacerbation of psoriasis. Respiratory infections, strep throat, and skin infections may play a role. Medications. Some medications have been associated with triggering or worsening psoriasis. These include certain antihypertensive drugs, antimalarial medications, lithium, and nonsteroidal anti-inflammatory drugs, NSAIDs. Psoriasis risk factors. Risk factors include genetic predisposition and lifestyle factors such as alcohol consumption and smoking. Certain genes associated with the immune system are implicated in psoriasis. Additionally, excessive alcohol consumption and smoking can increase the risk. Lifestyle factors. Alcohol consumption. Excessive alcohol consumption is recognized as a lifestyle factor that can contribute to an increased risk of developing psoriasis. Individuals who consume alcohol excessively, especially younger men, are at a higher risk. Moreover, alcohol consumption can impact the effectiveness of psoriasis treatments. Managing alcohol intake may be considered as part of a comprehensive approach to psoriasis care. Smoking. Smoking is another lifestyle factor associated with an elevated risk of psoriasis. Individuals who smoke not only have a higher likelihood of developing psoriasis but also face challenges in effectively managing symptoms. Smoking has been particularly linked to a more challenging to treat type of psoriasis known as pustular psoriasis, which affects the palms of the hands and soles of the feet. Quitting smoking may be beneficial for both preventing and managing psoriasis. Who gets psoriasis? Psoriasis is a widespread skin condition, affecting approximately 2 to 3% of the global population. The prevalence can vary across regions, with certain geographical areas experiencing higher rates. Notably, psoriasis is most common in Northern Europe, where a larger percentage of the population is affected. Conversely, its occurrence is less frequent in Eastern Asia. Psoriasis diagnosis. Physical exam. Diagnosing psoriasis typically involves a thorough physical examination by a healthcare professional, often a dermatologist. Visible symptoms, such as plaques, are key indicators. Common areas examined include the scalp, ears, elbows, knees, belly button, and nails. Lab tests. In some cases, additional diagnostic measures may be taken. Lab tests, including a skin biopsy, can be conducted to confirm the diagnosis and rule out other skin conditions. A biopsy involves the removal of a small piece of skin for microscopic examination, helping to differentiate psoriasis from other dermatological disorders. Stages of psoriasis. Psoriasis, unlike some other medical conditions, does not have clearly defined stages. Instead, it is characterized by a chronic and relapsing nature, meaning that symptoms may persist, improve, or worsen over time. The severity of symptoms can vary widely among individuals. Progression over time. While psoriasis itself does not have defined stages, the symptoms may progress, especially if not effectively managed. Early detection and intervention are crucial to prevent the development of severe complications. With appropriate treatment and lifestyle modifications, individuals with psoriasis can often achieve better symptom control and maintain a good quality of life. Psoriasis treatment. Treatment options range from topical medications and light therapy to more intensive approaches for severe cases, including biologics and systemic medications. Lifestyle modifications, such as avoiding triggers and adopting a healthy diet, can complement medical interventions. Topical medications. Steroid creams. These creams help reduce inflammation and itching in localized areas affected by psoriasis. Prescription topical creams. Medications like roflumilast, Zoryve, may be prescribed for more targeted treatment of psoriatic plaques. Moisturizers. Regular use of moisturizers helps alleviate dry skin associated with psoriasis and can be part of a daily skincare routine. Salicylic acid. This is often used to help remove scales and promote the shedding of dead skin cells. Coal tar. Available in various formulations, including lotions, creams, foams, shampoos, and bath solutions, coal tar is a common treatment for scalp psoriasis. Vitamin D-based cream or ointment. Stronger formulations, ordered by a doctor, can be effective in controlling psoriasis symptoms. Retinoid creams. These creams, derived from vitamin A, can help in slowing skin cell growth. Calcineurin inhibitors. Medications like tacrolimus and pimecrolimus can be applied to reduce inflammation. Anthralin. This medication helps normalize DNA activity in skin cells and can be applied as a cream, ointment, or paste. Light therapy, phototherapy. Involves exposing the skin to ultraviolet, UV, light under controlled conditions. UVA, Psoriasis plus ultraviolet A radiation, is a specific type of light therapy that combines a light sensitizing medication, Psoriasis, with UVA light. Systemic medications for moderate to severe psoriasis. Methotrexate, used for serious cases, but requires close monitoring due to potential side effects. Retinoids, oral retinoids related to vitamin A, reserved for cases not responsive to other treatments. Cyclosporin, an immunosuppressive drug used in severe cases, closely monitored for potential side effects. Biologic treatments, target specific aspects of the immune system, including drugs like adalimumab, Humira, infliximab, Remicade, and ustekinumab, Stelara. Non-biologic treatments. Tofacitinib, Xeljanz, an oral medication. Enzyme inhibitors, apremilast, Otezla, and deucravacitinib, Sodiq-2, are pills that block specific enzymes, helping to control inflammation. Aryl hydrocarbon receptor, AHR, agonist, tapinarof, Vtama, a steroid-free topical cream. Lifestyle modifications. Avoiding triggers. Identifying and avoiding factors that trigger psoriasis flare-ups, such as stress, certain medications, or infections. Adopting a healthy diet. Some individuals find relief from symptoms by incorporating anti-inflammatory foods into their diet. While there's no specific psoriasis diet, a balanced and nutritious diet can contribute to overall well-being. Psoriasis prognosis. Psoriasis prognosis. Psoriasis is a chronic condition, meaning it lasts a lifetime. However, the course of the disease is characterized by periods of remission, during which symptoms may improve or even disappear, followed by flare-ups, where symptoms worsen. While there is no cure for psoriasis, effective treatments can significantly alleviate symptoms, enhancing the overall quality of life for individuals with the condition. Managing inflammation, a central component of psoriasis, not only improves skin health, but may also contribute to reducing the risk of associated conditions, such as heart disease. Living with psoriasis. Healthy lifestyle practices. Adopting a healthy lifestyle can positively impact psoriasis. This includes maintaining a balanced diet, engaging in regular exercise, and avoiding excessive alcohol consumption and smoking. Skin care. Regular moisturizing helps alleviate dry skin, a common symptom of psoriasis. Using gentle skincare products and avoiding harsh chemicals can contribute to overall skin health. Medical advice and treatment. Seeking medical advice from a dermatologist is crucial for developing an effective treatment plan. This may involve topical medications, systemic treatments, or light therapy, depending on the severity of symptoms. Awareness of triggers. Identifying and avoiding triggers that can exacerbate psoriasis symptoms, such as stress, specific medications, or infections, is key to managing the condition effectively. Mental health. Psoriasis can impact mental health, leading to conditions such as anxiety or depression. Maintaining good mental health through stress management, counseling, or support groups is essential for overall well-being. Monitoring for complications. Individuals with psoriasis should be vigilant about potential complications associated with the condition. Regular health checkups can help monitor for conditions such as psoriatic arthritis, cardiovascular issues, or other autoimmune diseases. Journaling and self-monitoring. Keeping a journal to track triggers, symptom patterns, and the effectiveness of treatments can empower individuals to actively manage their condition. Psoriasis triggers. Various factors, including hormonal changes, stress, medications, infections, sunlight exposure, skin injuries, weight, and weather conditions, can trigger or exacerbate psoriasis. Hormonal changes. Hormonal fluctuations, such as those occurring during puberty, menopause, and pregnancy, can impact psoriasis. Some individuals may experience symptom flare-ups during these periods. Stress. Emotional stress is a well-recognized trigger for psoriasis. High stress levels can exacerbate symptoms or contribute to the onset of psoriasis in susceptible individuals. Medications. Certain medications have been associated with triggering or worsening psoriasis. These include lithium, used to treat bipolar disorder, beta blockers, angiotensin-converting enzyme, ACE, inhibitors, and antimalarial drugs. Infections. Infections, particularly streptococcal infections, are linked to the development or exacerbation of psoriasis. Strep throat, respiratory infections, and skin infections may act as triggers. Sunlight exposure. While some individuals find relief from psoriasis symptoms with controlled exposure to sunlight, for others, excessive sunlight or bad sunburn can trigger or worsen the condition. Protection of the skin during sun exposure is essential. Skin injuries. Skin trauma, such as cuts, scrapes, bug bites, or excessive scratching, can trigger psoriasis or lead to flare-ups in affected areas. Weight. Obesity is associated with an increased risk of psoriasis, especially in skin creases and folds. Maintaining a healthy weight is considered beneficial for managing psoriasis. Weather conditions. Psoriasis symptoms may worsen in certain weather conditions. Cold and dry weather, common during winter, can contribute to skin dryness and exacerbate symptoms. Using moisturizers and humidifiers can help mitigate these effects. Conclusion. Psoriasis is a complex and chronic skin disorder characterized by the rapid multiplication of skin cells, resulting in bumpy patches that can vary in color and texture. The symptoms, ranging from plaques to nail issues and psoriatic arthritis, can significantly impact an individual's quality of life. Importantly, psoriasis is not contagious and often has a genetic component, with more than 80 genes identified as different in individuals with psoriasis. The exact cause of psoriasis remains elusive, but it is widely accepted that immunological factors and genetic predisposition play significant roles. Environmental triggers, including cuts, stress, infections, and certain medications, can exacerbate the condition. Lifestyle factors such as alcohol consumption and smoking also contribute to the risk of developing psoriasis. Diagnosis involves a physical examination, with lab tests, including skin biopsy, conducted in some cases to rule out other skin conditions. While psoriasis doesn't have defined stages, early detection and intervention are crucial to prevent severe complications. Treatment options are diverse, ranging from topical medications and light therapy to more intensive approaches for severe cases, such as biologics and systemic medications. Lifestyle modifications, including avoiding triggers and adopting a healthy diet, complement medical interventions. Living with psoriasis requires adopting healthy lifestyle practices, moisturizing the skin, seeking medical advice for appropriate treatments, and being aware of triggers and potential complications. While there is no cure, effective treatment can significantly reduce symptoms and improve the overall quality of life for individuals with psoriasis. Managing inflammation not only benefits skin health but may also reduce the risk of associated conditions like heart disease. In conclusion, a comprehensive approach that combines medical interventions with lifestyle modifications and ongoing awareness empowers individuals to manage psoriasis actively and enhance their well-being. Your health matters. Quali.health